Okay, I think we can start now.
Okay, sir. Okay, good evening, parents. I am Indrani from CAGS CAGS resource team, and I extend a very warm welcome to all parents and especially Dr. Syeda Ruksheda. I'll give a brief introduction of Dr. Ruksheda. She is an eminent psychiatrist and psychotherapist, and she serves as the co-chair of Women's Mental Health Specialty Section of Indian Psychiatric Society. She is also in the executive council member of the Indian Association of Private Psychiatry and National General Secretary of Indian Association of Biological Psychiatry. Ma'am has a thriving practice in Andheri, Lokhandwala, Mumbai, and it has been there for about 20 years now. She specializes in dealing with adolescents, young adults, women, family, all kind of mental health issues. She's a celebrated speaker on mental health, and she has two TEDx talks to her credit, amongst her other various other media appearances that she's always doing. Right now, ma'am wishes that she was on a vacation and masks were a thing of the past. But unfortunately, none of us are in that situation. From her insights on depression to how to handle stress during these corona times, she shows a clear line of action how to handle your mental health issues during our these stressful times. Her presence, when you start seeing her and listening to her, you will see that her presence in any forum is so reassuring that for her clients they feel that they're in the right hands to recovery at any point of time. So let's hear it from ma'am, as she wants to give us her insights into it. So ma'am, you can please start sharing your views on the topic today, that is returning back to school bothering you all? Thank you, ma'am. Over to you.
Thank you so much, Indrani Miss, and I'm really obliged to Children's Academy of a group of schools for having me over. And I must big shout out to Amandeep and happy birthday once again, and Komal who's also been in touch. And I see Mr. Ronit Bhatia. So thank you very much for having me here because I'm the happiest talking mental health. My mate just left, but I'm still happy and smiling. So you can note that that's how much I love talking about mental health. And yeah, teenagers and young adults, they're very special to me. I've been working with teenagers for 20 years now. So just before we started the session, I was talking about how I think that like all of us, in not only just in the psychiatry community and the families and parents, we're all recognizing how important it is for schools now to start, for colleges now to start, for having a rational kind of way of looking at it. Because a few months last year, for a few months, we were telling everybody, don't worry about it. It's okay if your kids don't go to school for a few months. That's more imperative. But that was a different time, isn't it? And now, thankfully, we know more about the illness. We know more about the pandemic. We know how to take care of ourselves. And this has extended over a period of time that we are concerned about the impact that it's having on our children and young adults and teenagers, isn't it? We don't want them to kind of, we know we send our children to schools, we pick our schools because we want them to get a holistic background, holistic education. We're not just concerned about the grades that they're getting, though they are very important for life as well. Having said that, we want that kind of atmosphere there where they're learning and thriving. Sure, at home and with families we can do a whole lot with them, but they also require not only just some other authority figures in their lives, so they learn discipline, but also peers whom they interact with and learn and grow. Especially when I'm a teenager, I'm going to grow more. I'm going to grow exponentially when I'm interacting with my peers, and not so much when I'm being spoken to by my by the older adults in my life, isn't it? So we recognize all of that, but we also recognize that with the last almost 2 years now, coming on to 2 years now, life has been so uncertain. It's bound to make us anxious, isn't it? And it's important for us to just acknowledge that yes, this is stressful or this is bothering me, and I want to do this, but I'm not so sure whether this is the right thing for me to do. So it's okay. So the first thing we need to do is just accept that it's okay to feel anxious, it's okay to have questions, it's okay to worry, it's okay to to have these feelings. Yes, but it's also not probably okay for me as a functioning adult with children under my care that I'm responsible for, to become so anxious and overwhelmed and overwrought that I might then not be able to make rational and relevant decisions for them, isn't it? We always say that it takes a village to raise a child. So, in the similar manner, for us recognizing our children need more support for their normal development, not just for their normal development as anyone else, but for their normal brains to develop, they need more than just sitting in front of the computer and studying. Thankfully, the teachers have done such an amazing job over the last 1.5 years, where they've kind of reinvented themselves and figured out creative ways of teaching and engaging with students. But it's not enough. It's not enough for the development of a child. So, as we from the Indian Psychiatric Society, the Indian fraternity, psychiatric, all mental health professionals of our country, we are very, very sure we want schools to reopen. Of course, that needs to be done very judiciously and cautiously. And of course, we need to teach our children what to do and how to do it. And because of that, we need to model it, isn't it? I can't not be wearing a mask and then expect my child to wear a mask, especially when my child is not under my current, my direct eyesight, isn't it? So simple things like that is something that, if we are going to be conscientious and we are going to do the right thing, our children are going to follow. If I see that, okay, my child is getting excessively anxious, which unfortunately we've seen a lot of children having symptoms of anxiety, symptoms of obsessive compulsive disorder purely because of this. So the kind of health anxiety that they had, because initially the scare was so much, isn't it? And then the second wave didn't help, with so many deaths, unfortunately, so many oxygen deaths, unfortunately. So all of those things have taken a toll on our children as well, and some of them are bound to get anxious themselves. So not just the parents who might be anxious, but also the children who are going to be anxious. And the third part is, though our teachers and the school staff may be enthusiastic and very dedicated to our children, they're also going to be a little apprehensive. So, if I want my child to go back to school, I need to be able to reassure my teacher as well, that my child's teacher as well, that, what, we're all taking care of ourselves. So you don't worry and you can come to school and teach my kid. So I think that's another element that we definitely want to look into, because we don't want to endanger anybody in that environment. Schools, especially schools and colleges, they're supposed to be safe zones for our kids. We're supposed to be absolutely like, if my kid is in the school, I don't even think about it, and I'm going ahead with my business and whatever it is that I'm doing. So we need to create that kind of safe zone again. And to create that safe zone in a period of anxiety and uncertainty is going to be a little bit more challenging, and that's why all of us need to come together and address these things and, figure these things out. Okay, how do we go about this emotionally, physically, virtually as well, and cooperate with each other. So whatever the kind of, like, step ladder approach that we might take, we want to, now is more than ever, now is the time to work together as a team. And, a parent teacher and the management team is very important, because at the end of the day, all our goals are the same, that we want the development of our children to be normal and healthy. So, I'm going to, like, I can very wax poetic about mental health and be unstoppable. So, but I am going to stop here, because with the Q&A kind of a thing, I think it's a better approach, and we've kind of figured out more. I don't want to come here and assume that I know all of your concerns. I would rather hear your concerns and then maybe try and address them, and hopefully give you all some tips to overcome those kind of challenges and concerns. So, at this point, I think, like I said, I would rather continue talking, but in a Q&A format.
Yes, ma'am. Thank you. And I would like Komal to please start, flashing the questions to ma'am so that she can take them up.
Yes, yes, thank you. Good evening, parents. Good evening, Ruksheda ma'am, and all the dignitaries present here, and my team. Okay, so we have a lot of questions coming in from parents already before the webinar started. And one common question that I found, and I think that all the parents will be able to relate to, is one of the parents asked that my child is very introverted and absolutely settled in the whole online school system. And she's very shy. She doesn't want to return back to the old traditional way of schooling. And but she needs to embrace this change. And I, as a parent, don't know how to help her out. So, what would you like to say about this?
So thank you very much for that question. I have patients who've done and flowered and flourished and bloomed in the people who have social anxiety and all of that during this pandemic. So I completely get where you're coming from and understand where you're coming from. And especially if your child, if the child finds it difficult to have peer interaction, it's understandable that you're concerned about it. So the first thing is that we need to be very accepting. We need to be accepting of the child with whatever personality that they have. Not all of us need to have everything in terms of, oh, we need to be socially equipped, oh, we need to be academically great, oh, we need to have a sensible head on our shoulders kind of a thing. Yes, those are, we all dream everything for our kid, but the first thing we need to do is accept our kid for who they are and not look at their qualities or characteristics as a fault or a disorder or a disability or a lack, right? When we are okay with our child, however our child is, the child is going to be okay with him or herself, however they are. Having said that, once hopefully we don't kind of let our children feel or think that there's something wrong with them or there's something lacking. However, in this particular case where children have become very kind of comfortable and having that kind of like barrier of a screen and things, and that's allowed them to function better socially as well. So yes, we do need to approach it in a way that we tell them that, okay, yes, see, you remind them, right? We always reassure our kid and encourage our kid based on reality and based on the facts that we already have. So to say that, okay, maybe 2 years ago you weren't very okay with social interaction, but over the last 1.5 years you've been so much better, and you can do this, you'll be able to. So a lot of reality based reassurance is going to come in your way. And again, when we had to be very matter of fact about doing school on a virtual level, the kids are also going to be very matter of fact because we are matter of fact about going in person. As far as when a kid is struggling, it's never a great idea to tell them कि इसमें क्या है तो क्या हुआ है, ये तो इसमें कोई फिक्र करने की ज़रूरत ही नहीं है. I would rather instead we say कि हाँ, I can see that this is distressing you and I see that you're getting trouble with it, but you know what, let's try this out, and if this doesn't work out, we'll figure out a way together how to make it work. So when you tell your child it's okay for the child to feel whatever the child is feeling, whether that's anxiety, whether that's apprehension about a certain thing, so you're validating their emotions, so they don't feel so isolated, and they're not so defensive either. So then they don't dig in their heels and be stubborn about it कि नहीं मैं तो नहीं ही करूँगी. So hopefully that's okay. And maybe initially what could happen is that if they're very very reticent and it's really a lot of struggle, then maybe kind of like get together with a smaller group of friends, or people that she's more familiar with, so she kind of like gets acclimatized, he or she gets acclimatized in terms of hanging out with friends again and everything. And again, if we don't say that and we don't insist that you must have friends, that's, I think, important. So instead, if we say that, oh, who do you like spending time with, oh, what do you do with that person that you spend time with, oh, can you play without really talking to somebody, that's possible as well. I know I was a very very shy child, and I would go down and play every day, really without really talking to other people, because I was so shy. And that was okay, because the play in itself was also okay, and the play was something that I really needed, because that was the only way I could interact socially with my peers and not feel like a weirdo, right? So simple small little things is something that you can do, and encouraging your child and being positive about it is going to be good. But of course, we don't want to be toxic positivity. We want to avoid that. We want to be very realistic, and we can say things like, okay, yeah, let's take it one step forward, go to school, You come back and you tell me what's not working, so then we can try and fix it and we can figure out what to do and how to do it. Let me see that, okay, if you do meet a friend, what can you say, how can you say it, so let's do this whole role play. Sometimes even those simple things can really help your child get through that, overcome that anxiety. And if the child feels that, okay, no, I don't want you to tell me, give that child that space and don't push advice and instructions on your child. And yeah, and like I said, the best thing is that, we treat the child, we treat every child as normal, because it's normal for them.
Right, and I think introversion or being shy is part of a personality. It's not something that we need to consider it as a disorder or something that's abnormal out of the way. And of course, as you mentioned, that we need to be accepting and validate their feelings and thoughts. And this is not something that they have experienced earlier. This is something it's new for everyone, including the parents. So I hope parents will take that. Okay, so moving on to the next question. So this parent is saying that her child is in grade 1 and she hasn't attended school yet. And she's dependent on me completely, feeling anxious and would not want to leave me alone. I think this is directing towards, being anxious about separation, I suppose.
So again, we are concerned about children who've never really experienced school, and especially if my child hasn't been going to kindergarten, and because those are shorter hours,
Right.
and now is supposed to go to first grade, which with a longer time in the day, it is rather concerning. But again, once unless and until we try it, we wouldn't know how good or bad the child is going to have, of an experience the child is going to have. So if there is, I'm sure the schools also appreciate all of this, especially for first graders like your child. And if the child requires to leave early, or to come a little like late, or things like that, whatever the child requires initially to kind of readjust to school, I'm sure if you speak to the schools, they will also kind of understand. And in fact, the teacher would be one of the best resource persons that you have in terms of dealing with the issue. Right now the child, has you on the tip of the fingers, so there you're always there, you're always around. So again, it doesn't mean that when you're not around, the child is automatically going to be anxious. Of course, few kind of uncertain moments initially, but once the child sees other children and they're playing and it seems like fun, I'm sure they'll take to school, right, like duck to duck to water as such. So unless and until we try it, we're not going to be able to troubleshoot and problem shoot. So yeah, so don't be discouraged, and he'll be okay, he'll be fine.
Absolutely. And I also think that teachers can act as mediators and ask the children to, or rather, make our school environment more attractive in their imaginary world and get them to come back. And of course, and parents have to just wait and see how the first day goes. Maybe the first 2 days are difficult, but later on, I'm sure things can go back to.
Yeah, so I think the parents are also going to be apprehensive, because they're going to feel
Mhm.
that the school, especially for the younger grades, is going to be as structured and as it used to be. But I'm sure everybody recognizes that, especially the first 1 week, we can't start as if nothing happened and there is no transition period.
Right.
So I think everybody's sensitive about it, and clearly you guys know what y'all are doing. And yeah, I think, and it's okay to just kind of figure that out first, instead of, so the idea that we have of school might not really be the real thing. So the teachers and principals are going to be conscious about transitioning. And again, when the schools are going to start to, they're going to do it in step ladder approach, like I said. So maybe alternate week, or maybe,
Right.
some kids tomorrow. So every school is going to also adapt steps that are going to be easy for the school, the management, as well as the children. And yeah, so working together as a team, again, like I'm going to repeat this again and again,
Right.
that's what's going to get us through the day.
I'm sure parents will feel much safer after knowing this. All right, so coming to the next question. My child refuses to go out and play. He wants to just sit at home and he is addicted to screens and he keeps playing video games or he's just either studying online, but he's always found with a screen. How do we deal with that? Because now we're going to be having a sudden change, or rather, it's a slow, but then it's still a big change. I mean.
हाँ, ये तो बड़ा मसला है ना। आई थिंक हर घर में यही सिचुएशन चल रहा है कि बच्चे तो छोड़ो, अडल्ट्स भी हम फॉरएवर वी आर ग्लूड टू द स्क्रीन ओनली ना ऐसे। So that is another a very practical challenge. And what I would say again is do a stepladder thing that I'm sure you guys already do it, but I'm going to reiterate anyway, that जब मील टाइम होता है, हम सब लोग खाने के लिए बैठ रहे हैं, या भले हम सब खाने के लिए नहीं बैठ रहे हैं, अगर बच्चा खाने के लिए बैठा है, तो उस वक्त ना टेलीविजन ऑन होना चाहिए, ना मोबाइल ऑन होना चाहिए, ना टैब ऑन होना चाहिए. आई नो लॉट ऑफ पेरेंट्स विल से दैट ओके if the tab is on and the Peppa Pig is going on, the child is going to finish eating faster because I need to go back to my work. I understand that, but now especially we need to do kind of like maybe you need to take like a little bit more time off from work so that the next couple of weeks you can ensure that the child knows what to do with himself or herself without a screen attached to their palms. So because it's all of a sudden agar we just yank it out of their hands, it's not going to be okay. And make it that कि नीचे चले जाओ, थोड़ा खेल लो, अगर खेल भी नहीं रहे हैं तो थोड़ा टहल लो, just go out down with your child, stroll around with no cell phones, play a little bit, and a little gully cricket with your own kid, even if it's just one you and one child, that's perfectly okay. So again, the child is going to figure out that okay, yeah. And if it's something that you have to do, like if you tell your child कि नहीं अभी हमको नीचे जाना है, हम घर पर नहीं बैठ सकते हैं, हमको आधा घंटा तो जाना ही पड़ेगा नीचे, so then again धीरे धीरे they're going to get used to it as well. And so because addiction of any kind is very difficult, right? And our kids, where their brains are not yet developed, they are for them to unlearn a habit is going to take some time. So I think it's important for us to be patient, have empathy and compassion for our kids who've developed this habit, and not get annoyed that they're not snapping out of this. Because we've also relied on these devices and all of that over the last 1.5 years. So now all of a sudden to blame our children that they're addicted is not fair. It's definitely not okay. So we want to be, like I said, be empathetic about it, and again take a step by step approach. Lead by example. Don't switch on your phone when you're eating and say that हाँ मैं बड़ा हूँ, मेरा काम चल रहा है, तो मेरा फोन तो हमेशा ऑन रहेगा. नहीं, ऐसा कुछ नहीं है. ऐसा नहीं हो सकता है कि हमारा फोन हमेशा ऑन रहेगा. तो अगर हमें हमारा जो घर का जो एटमॉस्फेयर है और हमारा जो माहौल है, अगर हमने उसको इस तरह क्रिएट किया, तो वो बच्चों को पता चल जाएगा अब तो मेरी दाल नहीं गलेगी, मुझे तो अपना मोबाइल देना पड़ेगा, गिव अप करना पड़ेगा. सो दे इट विल बी ईजियर. एंड व्हेन दे सी अदर्स आर आल्सो डूइंग इट, तो वो दे विल आल्सो स्टार्ट डूइंग इट, बिकॉज़ फॉर चिल्ड्रन इट्स वेरी इंपॉर्टेंट फॉर देम टू काइंड ऑफ फील लाइक एवरीबody else, right? Their peers and all of that.
Absolutely.
तो वो हो जाएगा धीरे धीरे, not a problem. But yes, we do have to make steps where we are sure that they don't get access to devices. We are sure the kid is going to come and complain to you that I'm bored. In fact, just recent, like last year, my nephew had said something. My sister and my nephew were going on, and she had posted something on Facebook, because he would go and tell my sister that I'm bored, and then she would be like, "Acha, you're bored now. Acha, what can we do? Can you play this? Can you play that?" And I was like, "No, you know what? If he's bored, sometimes it's okay for you not to intervene and tell him what to do, and it's good for him to figure out what to do." That's how we encourage creativity. If the child is never bored, the child is never going to come up with a game to play on his own. And that kind of imagination is important for brain development, not because we want him to grow up and be a movie script writer. That's not what we mean by creativity at all. So and he was like, "Ek to you should have never spoken to her only," because that idea is coming from me. So she just kind of like
Right.
that was a memory that came up on Facebook again. So yeah, it's important for us to kind of like let them get bored and tell them that, not like, oh, deal with it, but like, oh, what do you think you can do? Oh, what do you think you have in the house? Do you have any other toys that you can play with? So give them hints, give them help, but definitely allow them to do their own problem solving as far as getting bored is concerned.
Right. If they have that much free time, I'm sure that they can figure out themselves. And there are a lot of kids who engage in art and craft activities, or they come up with other ideas. They meet their friends or play outside because they just don't have any other option. They're not going to get the screen in their hands.
Right. And
And
also, it's,
yeah,
we need to not be obsessed with our children
yeah,
being constantly active.
active,
It's
right?
okay if they're just lying down, doing nothing but looking at the sky or the ceiling for that matter, and thinking
Absolutely.
up stories. We start getting apprehensive and scared ourselves कि oh कुछ नहीं कर रहा है, क्यों नहीं कर रहा है, कुछ तो दे दो उसको, कुछ तो करा दो. So we need to get we need to stop being scared of that. It's good for them to just intuit maybe, or just observe maybe, how, I mean, we need to give them time to even figure out what their favorite color is, or what they like and don't like, and they're not going to be able to do that if they're constantly engaged in something. So yeah.
Absolutely. I think the parents were more concerned about that since all kinds of curricular activities were closed for all these months. But I'm sure that they can take some tips from here. And as you said, go stepwise. Just take one day at a time, one step at a time. And in the day, parents need to spend about 1 hour or half an hour to 1 hour at least without a screen with their child. I think that should really, really help. Okay, so the next question is this is a little generic. How to identify and know that my child is suffering from any mental health concern for that matter?
So when we're looking, so okay, so mental health concerns are again very different, isn't it?
Mhm.
If I'm talking about childhood issues, let's say like attention deficit hyperactivity disorder, learning disabilities of some kind, autistic spectrum disorder, or some other kind of behavioral issues, that's one aspect of it. And if you're looking at a little older children, maybe 7, 8, 9, 10 onwards, then we are looking, then mental health concerns, are we then considering also depression, anxiety? So I'm not sure exactly what category you're asking, but what I can tell you is that when you see that there is a shift in pattern, because we all know our kids, isn't it? We
Mhm.
know by the sound of their crying, what is it that they are, they really crying, or are they just putting on an act, right? So we know our children. So when we know that, okay, there are certain kind of like shifts happening, especially if you see your child getting cranky, your child getting lethargic, your child not really engaging where they used to engage, not enjoying what they used to enjoy. And this has been going on for like, for some time, not just like 2 3 days here and there, but
Yeah.
maybe consistently over a couple of weeks or more. That's probably when you want to just figure out, is everything okay? And you want to get it checked out, right? When we're talking about, okay, symptoms of ADHD, because the kids have been at home the whole time and glued to the screen. So again, and a lot of these kids in the last 1.5 2 years haven't gotten diagnosed, should have been diagnosed. So there could be either a risk of overdiagnosis or underdiagnosis at that time,
Mhm.
definitely. But we want to make sure that, okay, we're being careful, we're being cautious, and we are getting it checked out if we are concerned, and we are not going to make be certain that there's something wrong with our kid, because because that again, if I become an anxious parent, I'm a less observant parent. So even if I know if a parent is if an anxious parent is coming in, because I need history from the parent, isn't it? And if I'm asking them something but they've been so anxious, they don't even know, I don't know, I think what you're saying might have happened or is happening. So again, it becomes difficult for the professionals also to help you. So I'm going to say, let the professionals do their job. If you have concerns, go and ask them. If there's something that needs to be looked into, they will do that job. So you do your job and let them do their job, divide and conquer. So if you have concerns, definitely bring it up. Speak to the school counselor. If they see that no, there is something, they'll escalate it to other professionals. You have resources available to you. We need to be, take advantage of those resources. And just because you may be at worst case scenario, okay, the child needs help, and the best case scenario, okay, the child doesn't need help. Either which ways, we're going to do what is best for our kid. So yeah, if you see kind of changes of pattern, or if you think that there might be something, absolutely no harm in asking. And you doing that is again going to normalize it for everybody else as well. Because sometimes we do have resource rooms in the schools, but children themselves are so stigmatized that no, I don't want to go to that room.
Mhm.
If I get diagnosed, I'm going to have to sit in that room and give exams. So we don't want that to happen. We want the resource room to be like an open space practically, where if somebody goes in and asks some question, that's a good thing, instead of, oh, what's wrong with you, kind of a thing. So if parents need to be okay with that, and kind of like destigmatize that as well. So yeah, and if you make it okay that, oh, I have some concerns, so I'm going to ask a doctor, the kids are going to follow suit and say that, oh, I have some concerns, I'm going to ask the doctor. And so we do this in our family. Even if the child is as young as 6 7 8 years of age, and we take them to the pediatrician maybe, or the ENT specialist or whoever, we will tell the doctor what's going on, but we see to it that the child tells the doctor what's going on, because we want to make sure that the children know that, okay, this is my doctor, I've come here for help, and it's important for me to tell them what's going on. And of course, they'll miss out certain symptoms, or they will say something else entirely when the problem is something else. It's fine. It's just a matter of, getting into the practice of it. So yeah, take ask for help for yourself and ask for help for your kid, and make it normal for them to do that. And whatever it is, we are going to do what needs to get done. So there's no worry.
Right, absolutely. We need to normalize that meeting a counselor, meeting any mental health professional is absolutely okay, all right. It's not like they're going to label you on day one that this is wrong with your child. I mean, you're just going there to check if there is something that concerns you or concerns the child. And I think that a parent, of course, as you said, shouldn't be as anxious, should be really relaxed and composed and just go and get it checked. Right. Okay. So the next question is, my child now refuses to hold a pencil. And yes, miss, I must tell you, a lot of children have missed out on that writing practice that they used to have in the school days, offline school days. And now they are more used to the cursor or the touchpad of the screens. So the concern of this parent over here is that my child is definitely bright and answers in the classroom, but refuses to hold the pencil again.
So again, there are, this is interesting in a way because it's layered. It's layered in the sense that, okay, my child would just may have found typing easier than writing. So nobody's going to do extra effort. That could be one part of it, which is okay, which is normal. So again, we could transition into that, okay, make them draw. So they are used to kind of using their hands, a crayon or a pencil, or in that sense, not like maybe paintbrush, but like maybe a crayon and a pencil. So, get them going with that. Maybe like, kind of like make them draw, make them make handmade greeting cards where they're supposed to write. So simple things like that, that they could start like getting used to writing a little bit, and then they realize that, oh, not all writing is going to be studies. So then that way the familiarity with the pen and the pencil might develop a little bit more. And as far as and once they go to school, trust me, because the teachers are saying it and the other kids are doing it and everybody has to do it, they will do it. So yes, you may be struggling with it at home right now because they don't need to do it, quote unquote, so they won't. But once schools and everything start, it's going to not be that much of an issue, trust me, because again, they're going to be part of the system, they're going to follow the system, and it'll be fine. On the other hand, if you have a younger child and refuses to write, a lot of the times it's also possible that children with dysgraphia find it difficult to write. So,
Mhm.
so it could be something that there is a learning disability of a certain kind, and that's why, because writing for them is difficult, not just because that it's tiring, not so much for that, but it's possible, but also because when they're writing, they're making more mistakes, right? So they might be like missing out on a alphabet here and there. So that's why they also do this. Very discouraging to
Right.
know in something in your head but not be able to put it down on paper. So that's another something that we might want to look into if that is a case. So again, like I said, that's why it's a little layered. So we don't want to just say that, oh, my child is lazy. We want to figure out that, okay, when they're writing, how they're writing. A lot of occupational therapy thing kind of comes in. What is the pressure that the child is using, what kind of muscles that the child is using for writing, which muscle might require a little bit of training, so that the power of the muscle and the tone of the muscle is normal, so that the writing becomes easier, that kind of a thing. So there are a lot of kind of things behind it. So yeah, I mean, I know that I hold my pen very, very wrongly. I've always done that as a kid. And when we were young, we didn't have information about all of this. So my parents didn't realize there was an issue. I didn't realize I had an issue till the time I became a psychiatrist and started working
Oh.
with kids. So yeah.
Well, as it is for most part in the future, nobody is going to be writing so much unless you become a writer or you stick to the whole practice of it. And I've always told that to the parents. But yes, in the area of academia, it is definitely important, something that you cannot really get away with. And I'm sure students will get used to it. Maybe few days it'll be a little difficult,
We
but then
we do
they'll
want our
get
children
into
to
the
write a
classroom.
little bit,
Yeah,
because
yeah.
talking about different develop areas of our
Exactly.
developing differently. So we don't necessarily we're not so concerned about, oh, them having good penmanship or them
Mm-hmm.
having to write cursive or write whatever. It's just a matter of, because again, because it's part of normal brain development, that's why we would insist on writing, otherwise not required.
So, but then, like, what do we ask the parents to do over here if the child at that moment is not willing to, get convinced and write and complete assignments? I've had a lot of parents complaining that my child waits until it's the last date of the assignment submission and then will start rushing to write but is not able to complete because the child doesn't have practice of writing for so many hours. And they wait until, like, they have 4 hours straight of writing one night before.
Right. So just like if I'm an adult and I'm procrastinating, I need to wonder why, isn't it? So just so similarly, if my child is procrastinating about something, I need to wonder why. And so sometimes I may have to make it, incentive oriented, that no, unless and until you finish this, we're not going to do something else, whatever that something else was going to be. So it's not a reward punishment thing. It's about that, no, we need to do that, which is a pleasurable activity, but we need to first finish this, because without finishing this, we can't go to the next level, right? So I mean, they understand gaming, so
Exactly.
that, so when you make it like that, that, oh, it's not in my hands, you have to finish this level, only then can we go to the other level. That's a little easier, because if you do allow your child to keep it at the last minute, it's not going to be possible for that kid to do this. And yes, the kids are going to then rush it and then get not that many, not that good grades, and that's going to be a problem as well, because a lot of kids find it difficult because to study or to focus on work, because it is, for number of reasons, number of challenges, but they also want good grades, and when they don't get good grades, they go through emotional issues. So we want to make sure that, okay, if my child is going to do that, I need to be a little bit more diligent and be like, be more aware of helping my child to stick to a schedule, and not making it like the end all of everything. They're not in a militarized zone. So yeah, it's if I'm going to say that yes, we need to finish this, only then can we do something else, they will do it, maybe not with so much enthusiasm or grace or fitness, but that's all right.
Yeah. That's all right. And also, maybe the parent could check from day one itself if there is any delay in the assignment happening there and encourage the child. Is that what you would also like to say?
Yeah, supervision is important, isn't it? Like बहुत मर्तबा ऐसे होता है कि हम हमारे बच्चों को ट्यूशन्स के लिए इसलिए भेजते हैं क्योंकि हमें लगता है कि हम घर में नहीं देख पाएंगे, या हम नहीं देख सकते हैं, या हमें दूसरा इतना सारा काम रहता है, तो कहीं तो कोई तो देख रहा है। मगर फिर भी अगर बच्चे को लगेगा कि हाँ, माँ बाप भी पूछ रहे हैं कि हाँ, सारा होमवर्क किया नहीं किया, कहाँ किया, बता दो, उसके लिए ज़्यादा वक्त नहीं लगता है, 5-10 मिनट लगता है। और अगर बच्चे को ये भी लगेगा कि हाँ, वो देख रहे हैं मुझे, तो वो it also makes them feel that okay, my parents are interested and they're not just shirking the duties by sending me off to home, tuitions and things like that. So yeah, a little bit of supervision is very important, because otherwise we are allowing our children to parent themselves, which is not okay.
Absolutely. And I think when both the parents are working, they find it a little bit difficult to manage that at home. But yes, of course, I think removing 5-10 minutes out of the day is a must.
And even if the parents are, both of them are working, in those cases, what I do recommend is that, again, divide the kind of subjects, like the mother could take a few subjects and the father takes a few subjects. So that way, no one person is burdened. And at the same time, the child gets that kind of a different approach to studies, because, both parents are going to have a different approach to, making the child study as well. And then the child knows that, okay, yeah, both are interested, both have their eye on me. So that kind of also not just it encourages them to just do better. So with two when there is a two income household, two both parents are working, both parents need to pitch in even with schoolwork.
Absolutely. I think you've rightly said that. And we do have a lot of working parents. Okay. All right. Coming to the next question. I'm just going to read it out directly. My child is in nursery and doesn't eat or do anything without a phone. He is unable to concentrate in the online class too. So what can I do?
Well, the child is in nursery, right? So the clearly, my first concern is, why does a child have anything? Why does a child have the phone in the hand constantly? Right? Somewhere we've done that. Somewhere we've kind
Mhm.
of like dropped that ball, isn't it? So we need to kind of like get that back. So if the child needs entertainment while being eaten, so while eating, so initially what you could do is like not let the child have the phone, but tell them a story, play another kind of game while they're eating, so that they transition from like a game based, device based entertainment to maybe interpersonal exchange based entertainment. And then maybe like eventually, if all of y'all are eating together, none of y'all have any devices, then that encourages that kind of activity and action from them as well. So yeah, simple, you again need to kind of like do it piecemeal and step by step. And as far as engaging in school is concerned, yeah, I mean, nursery children, very very tough for us to make them sit and engage on online classes, because
Right.
so I would advise you, don't worry about it. When nursery kids, we're not really very concerned about them engaging and learning anything. We would rather more about, I mean, even the nursery class online is there so that they get they have access to other kids, and they're familiar with other children, honestly. So as far as studies and all of that is concerned, I'm sure the teachers here will also tell you, don't worry. It's not that your child is not going to learn. It's all right. Don't compare and don't worry that ABC nahi aata hai. So don't worry about it, I think. But yeah, this whole not being able to eat or function without the phone, somewhere we have to take responsibility for that, and face the consequences. And now we have to do corrective measures.
Absolutely. I would like to also ask something related to parents and their motivational levels.
Mhm.
A lot of parents that have come to us, they are absolutely exhausted and tired because they have never had spent so much time continuously with their child, uh, managing their schedule also with, and also they had to be studying. They were like as good as students sitting next to them in the online
Yeah.
platform. And so, what would you like to, say about that? Because they are also going through their own personal concerns, their anxiety, and they're worried that the child has not learned English properly because the child is not speaking with anybody in English. They are more used to their mother tongue at home, and they have frankly not been very focused online, and they would just just spend time taking some nibbles here and there, would eat in the middle of the class or just run away and then come back. And so they're really worried about how will they even transition into an offline setup. And they themselves are very anxious, even in spite of counselors giving them recommendations as to what they're supposed to be doing. I think after a certain point of time, maybe after a week or so, they again go back to uh, the same scenario, and they're not able to motivate themselves.
Oh, well, patterns. Now, we familiar patterns can be comforting,
Right.
but ultimately harmful. So yeah, a lot of empathy towards parents who are constantly kind of like, they're wearing so many hats now. All of a sudden, they're working, they're taking care of the house, they're also kind of being part teachers, not only just like doing homework, but actually making sure that they're sitting in front of the computer while attending class. So yeah, hats off to parents, honestly. And if you don't have enough adult companionship, I would suggest please take some time off and do that. I know it's time, like especially with younger children, it's not that easy to leave them unsupervised for a long period of time. Having said that, if you do have, even if it's your or just one partner in the house, or if there is extended family in the house, it's everybody's responsibility. So you can like essentially say that, okay, you're in charge of the parenting right now, and I'm going to go take my time off, whether that time off is just in the other part of the room, whether that time off is me going out for a walk, or whether that time is me going meeting people, adult interactions with other people, whatever it might be. And I'm going to use the term parenting and not babysitting, because if we have grandparents and everybody in the house as well, they're part of the parenting unit, honestly speaking. So they get the thrills, but they also get the responsibility. So, and as far as parent is concerned, of course they're never babysitting, they're always parenting. So it's important for us to kind of look at it like that. And yes, I may be doing this for the majority of time, but I this is not only me who's doing it. So So taking time off for yourself, having adult interactions, very important, because then what happens is that we don't even realize, and we slip in and we start treating the kids as adults as well, and we start expecting them to either just completely listen to us and have no autonomy of their own, or we expect them to do what we would expect a parent to do. So we do need that kind of different experiences ourselves. And as far as I'm sorry, what was the second thing?
Well, I'll also have to look at the question again. Well, yes, I was just engrossed in what you were actually mentioning here. Again, so they are not motivated. They just go back to, it's a
Right,
relapse situation that happens. They start
right.
off with, okay, I have the plan with me. I'm going to every day, time my child, get this thing done at 6, at 7, whatever, etc., etc. And then the fourth, fifth day, again, they just go back to being, letting those frequent outbursts of anger, projecting it on their child and getting frustrated. That's
Yeah.
that's the common situation that we have found in parents today.
So again, when we're human, we're going to be human beings, right? And we are going to lose our temper. We are going to probably displace, like you just said, and it's okay we do that sometimes, right? What then is important for us to do is, what do we do after that, right? I don't want to gaslight my child that, oh, I'm sorry I yelled at you, but it's your fault. We don't want to do that to our kids. We definitely want to say that, yes, I lost my temper, and yes, but the original issue that, yes, you should be doing this, you should be doing that, is true, right? So you can apologize for losing your temper, you can apologize for being angry, and you don't need to add that but you deserved it. You definitely don't want to do that. But you can go back to saying that, okay, I'm sorry I yelled at you and I lost my temper, but the original problem is this, let's focus on that again, right?
Right.
So you are saying that I am taking responsibility for my actions, but the problem still exists, and I'm not going to give you a free pass because of me losing my temper, and I'm not going to say me losing my temper is your fault. So it's a small distinction, but very, very important distinction. And as far as as parents as well, going back to
Mhm.
old habits, it's okay if we fall off the wagon. It's important for us to recognize, oh, I kind of missed that train again. So again, start, right? That, oh no, like I was we had a good tempo going, then again 2 3 days mate went off, again start. So this whole start stop in terms of a healthy routine, a healthy lifestyle, is okay. And it's okay for our children to see as well that the healthy routine lifestyle, which may be sustainable, but it's not that easy to continue to be motivated. But it's important for us to be persistent in us trying that, right? So even if I let go of it, I can't say that अब तो चलो क्या अभी क्या है, अभी 2 दिन नहीं किया, अब तीसरे दिन से वापस क्यों शुरू करना है? नहीं नहीं, 2 दिन नहीं किया, बट तीसरे दिन से वापस शुरू हम कर सकते हैं।
Hmm.
जब जाग उठा इंसान हो गया, तब पहला कदम उठा लो, नो प्रॉब्लम। So it's okay if you're doing stop start, right? It doesn't make you a bad person, doesn't make you an incompetent person or any of that kind. Go ahead and do it. If you think this is important, then even if you require to motivate yourself every few days, do it again. It's okay for your kids to see that you're trying, then you're losing, and then again you're trying, then you're losing. It's important for your kids to know that you're not going to give up on something that's healthy and good, just because you're not being able to be consistent with it. Perfection is not what we're looking at. Consistently helping self-help is what we're looking at. So yeah, it'll be,
Absolutely. And that's what makes us human, right?
of
I mean,
course.
and we need to let our children know that I am a human as a parent too, and I cannot be perfect. And there's nothing like perfect. That concept is just an illusion.
So I accept responsibility for my actions. I face the consequences of
Absolutely.
it, but at the same time, I'm still going to do the right thing. So and doesn't make just because I'm apologizing to my child does not make my authority less. That's where parents they get scared. कि if I
Absolutely.
apologize, they're going to, वो तो मेरे सर पे चढ़ के बैठेंगे. It doesn't happen. You're a parent. No matter what, you're going to be a parent. You don't need to make them fearful of you to wield that authority, isn't it? You can do you. It comes with love and affection as well. So yeah.
Absolutely, that's right. And I think parents need to know that it's okay to take a break also once in a week and just spend time with yourself, just recharge, rejuvenate, and get back. Like, just get up and follow your plan again. Just, it's never too late. Okay. We'll just take another question then. My child is in grade 5 and he's very emotional. He cries very frequently on small issues. Now, the parent has not really specified what kind of issues and how frequent, but it seems like it's very often that the child gets emotional or starts crying.
So whenever that happens, we will always, as a doctor, first check physically everything's okay. The
Mhm.
child is eating well. The child is sleeping well. The child is getting enough adequate amount of sleep. The sleep hygiene. There is enough exercise and play and activity. Not there's difference between exercise and play and activity. There is enough stimulation from a body point of view. The digestion is okay. There is nothing physically wrong with the child. Once all of that is okay, because you'll be amazed how often the child is cranky because there is a medical reason for that as well, even if it's
Mhm.
like low vitamins and things like that, or a child, especially if there's a family history of hypothyroidism, so you definitely want to look at that. So we first rule that out, and then we see that, okay, what is happening? Is the child cranky and crying? Is the child's, a lot of the times children with anxiety will either come up with irritability and rudeness, or they'll come up with crying. The low frustration tolerance is that, depending again what age group the child is, we will look at it from a different point of view. Is the child emotionally disturbed for some reason, or is this like a personality trait that's getting developed? And do I need to take professional help for it? So again, it needs to be looked at. If the child is crying, we don't want to shame the child for crying, but at the same time, if the child is wailing and screaming, you could sit there, you could do eye contact, you tell them, okay, I'm going to wait for you to calm down, and for you to then be able to tell me what is going on, what's wrong, and how can I help. So when you do some things like that, that is and you're not like really getting upset, that okay, so even if suppose the child is very bad, so they're like, okay, I can see that you're crying, you know what, I'm going to let you cry, and I'll come back in 10 minutes, then we'll sit and talk about what's going on. Because sometimes, yeah, with a crying child in your head,
Mhm.
you want to smack that kid, right? So it's okay for you to have that feeling. It's not okay for you to actually do it. So you want to take yourself away from that as well.
Right.
You can continue staying calm and continue being there for what your child needs. So that way.
Self control. A lot of self control there. Yes. Okay. We do have two more questions. We do have a lot of questions, but we'll not take more than two. Is that okay?
Yeah,
Yeah.
yeah, two is good.
Okay. The next question is something related to social skills, and I'm sure that a lot of students are going to be facing social skill issue. The question is, my daughter is a teenager and not able to have healthy friendship with others. Everyone feels that she is rude, but she is just straightforward and blunt. She feels that others avoid her.
Um, so first of all, we okay, teenagers are very difficult, right? In terms of because all of them are going through their own personal journey, own personal transformation. It's especially that's the time where everybody wants to be, everybody wants to be normal, but everybody wants to be unique. Nobody wants to be ordinary, and we somehow want that from our children as well. We want them to be normal but not be ordinary. So again, that's was something that comes up. If I do think that my teenager doesn't have a self-esteem or self-confidence, I'm going to help that, right? I'm going to, and if I think that her or his social skills are lacking, I'm going to, and especially because they're teenagers, you can actually have a talk with them. And if you don't think your child is going to open up and talk to you because now they are teenagers and they don't want, maybe you have another adult in your life that is very trustworthy adult that your child could speak to as well. So it's okay, right? Like a favorite aunt and a favorite uncle, or a good uncle and a good aunt is always like, just yesterday I was telling this friend of mine, okay, Baba, it's not easy being an aunt, because the kids will come and say something, and I kind of like need to like maybe translate it in a different way to the parents, that kind of a thing. And because she was also saying something similar to me, so if you have like a trusted adult, maybe they can speak to them as well. And if they have self-confidence issues, saying that they don't like me, first of all, we need to kind of like ask them, like, not that, Nani, that's not true, don't say that. Say that, okay, what makes you think like that? What is happening that made you think like that? Where did this inference come from that the people don't like you. And yeah, I mean, if you think that, okay, yeah, there's being, if she's being misunderstood as being rude, and if she says like that, then you don't want to tell her that, ha nahi, you have to pretend and you have to be polite. You have to say that, no, it's a communication skills, right? I mean, if you don't mean to be rude, you don't want to be misunderstood as rude. So but if people are thinking that you're being rude, you need to improve your communication, because it's your need that people understand what you're saying. मतलब अगर अगर तुम्हें अभी नहीं समझ में आएगा तो मैं हिंदी में बोलूँगी, नहीं समझ में आएगा तो मैं मराठी या गुजराती में बोलूँगी, क्योंकि मेरी गरज है कि तुम्हें समझे कि मैं क्या कह रही हूँ, right? So when we tell our people, when I tell our children, this is just communication skills, and these are skills that can be learned, right? And all of us require this kind of help sometime or the other. Not all of us can give PowerPoint presentations, not all of us are very good with public speaking, but these are skills that one can acquire if one wants. So, and what really works with children is that, are you judging them that they're judging you? So that makes sense to them, that, okay, maybe that's not true. It's maybe my fear that they don't like me, and not really that they don't like me. So you help your child with that. Maybe, and if they think that, okay, yeah, they're finding it difficult, then come up with ways, in terms of, okay, how to kind of like behave in a social setting, what happened the last time, if this happened again, what do you think you'll do differently. Help them help themselves, instead of giving them like instructions, okay, do this and do that, and don't do this or don't do that. Because we want to self empower, we want to empower our children, and that's what we do in counseling and therapy as well. We just don't dictate terms to them, ke ye kar lo, wo kar lo. So maybe, a similar approach would be good.
Okay. We do have a last question now. And I'm sorry, I'm just rushing through to the next question. Okay. Well, and I think this is a little bit important because this is something that I have also been hearing. It's a general complaint. Like every year I hear this. Parents still tend to compare their children with other children. And I don't think they're able to, sometimes, a few, I'm not talking about everybody, a few parents are not able to control their urges to compare. Obviously, they have their own expectations. And how do we help these parents or the children, both?
That Sharma ji ka beta to doesn't leave us only, no? Like, oh my God, and there's peer pressure at every age, isn't it? So even the parents are going through peer pressure when they feel that their kid has to be like somebody else's kid. So parents don't get given to peer
I would
pressure.
like to interrupt you and also add what also happens is that मेरा मेरे मेरे बेटे ने कुछ नहीं किया लॉकडाउन में। वो बस उसने ऑनलाइन अटेंड किया, उसमें भी वो खाना खा रहा था बीच में, कुछ नहीं किया उसने ज़्यादा, सिर्फ असाइनमेंट कंप्लीट किया। बट उनका बेटा, उनकी बेटी, दे अटेंडेड अदर ऑनलाइन एक्टिविटीज एंड दे took up extra tests or extra stuff that they've done, and they have achievements in like in 2 years. And that's the kind of comparison also happens also at home, of course, between siblings.
Right. So one thing is that, yes, as parents, we definitely don't want to live vicariously through our children. And we don't want to compete vicariously with other parents through our children. So we definitely don't want to do that. And the another thing is that if I'm going to compare them with other kids, they might start comparing other parents to me. What if they get more pocket money, and what if they go more, have more devices than we, so it did for that. They're going to demand what you're going to dish out as well. So you want to be careful about that. And a comparative thing never really works out, because what the child hears is not that, oh, look at that thing, that's so inspirational. What the child hears is, oh, you are not good enough, and I hope, I wished how you were not my kid. So how is that encouraging? We think parents they'll come and tell you, no, no, I'm just trying to show to them that, see, their own friend is doing this, you can also do this.
Right.
But what the child hears is very different, isn't it? The way their mind is at the different developmental ages, that it's different. So you don't want to compare two siblings either, in terms of, okay, this person has done this much, so you also want to do this much, because every human being has a need to be seen, to be heard, and to be accepted. And if my child thinks that I'm not seeing him or her, but I'm seeing some, just like a prototype, that's not okay. So by comparison, you're essentially negating that child's or that person's identity and existence, and you definitely don't want to do that. So if you bite your tongue down, get out of that habit, and focus on what your child is doing today, focus on what your child needs to get done today. Be appreciative of what the child has achieved, even if it's the child has done nothing but achieved, survived the pandemic and the lockdown without completely losing, all perspective of what's important, what's not important. That's a victory. That's a win. And other kids may have done certain other things, but you know what? Again, if what I can manage, somebody else can't, and what somebody else can manage, I can't. I cannot compare an apple and an orange. I will not compare myself to anybody, because I want my child to grow up and be themselves. And I want, because that's the only way my child is going to succeed, emotionally or financially or socially. So if I am going to, like I said, work with a prototype, then I am essentially saying that I'm reducing the chances of my child being successful. And so I refuse to do that. I
Absolutely. It's
refuse to
quite
be.
demotivating, in fact, and it can be counterproductive. You're trying to help, but you're not actually helping in that sense.
Yeah, yeah.
All
So yeah.
right. Thank you so much for answering so many questions. And we still have more questions, but we don't have time, unfortunately.
I'm so
And
sorry. Did I take too long answering certain
no, no, you
questions?
haven't. You haven't. And I think you were very crisp and I think to the point and giving us strategies as to what has to be done in all these different concerns, the questions that I mentioned.
Thank you
And
so much. तुम्हें थोड़ी और मेरी तारीफ करनी है तो चलेगा.
oh, but you do deserve it. So I'm still gonna go on. And also, I would like to mention this for all the parents. You can stay in touch with us if you have any concerns. All the counselors of your respective schools. So care team is always there, and also Ruksheda ma'am is there too. You can get in touch with her for, as we mentioned it earlier, a few questions ago. If you want to get anything, any concern evaluated, you want to get something checked, I'm sure Rukshida ma'am would be open for it, right? Yes. Okay, I'd like Indrani Miss to take over from here. Thank
Okay.
you.
So, ma'am, what came out very distinctly in the talk with you is acclimatization to the new normal is to be handled with very a lot of sensitivity, and it has to be done stepwise. And parents, relax. You need to be relaxed and not let your anxiety get better of the situation here. So thanks a lot, ma'am. I would extend my vote of thanks to our management, Rohit sir, Rohan sir, Ronit sir, Shraddha ma'am, Pratik and Nana from our branding team, and Vandana miss for helping us with the content. Special thanks to Komal for really taking up the most important questions, because, ma'am, we are flooded with questions. And of course, our resource team, which is such a good team, which brought about such a wonderful webinar by you. It was very, very nicely spent 1 hour in the evening today. Last and not the least, our heartfelt gratitude to you, ma'am, for taking out your precious time, addressing our parents, addressing their concerns, and thanks a lot, ma'am.
Thank you
With
so
that,
much. It's been a pleasure.
thank you, ma'am.
And best of luck to you and to the children and all to the parents, and more power to us.
I swear we all need it as educators, as parents, and of course as professionals. Thank you, ma'am.
Thank you.
Thank
Bye.
you,
Bye.
ma'am.
Bye. Good night.
Good